Birth control is one of the most prescribed medications in the world. It's used by over 100 million women worldwide, often not just for preventing pregnancy, but things like acne, heavy periods, PCOS, and even endometriosis. But here's the catch. While the pill or an IUD can seem like an easy fix, research shows that we can have wide-ranging effects on your hormones, on your mental health, on your gut health, and your long-term well-being, and even cancer risk. Today, we'll break down those risks, the science, and what you need to know if you're considering birth control, and is it worth it? Hi, my name is Dr. Arianne Missimer. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, and owner of the Movement Paradigm Integrative Health Center. So let's dive into the different methods. So let's start with the pill, the oral contraceptive. So this contains synthetic estrogen, so ethinyl estradiol, and progestin. So this is going to suppress ovulation, it thins the uterine lining, and it thickens cervical mucus. Hormonal IUDs, things like Mirena, Kylena, Skyla, Liletta, these are going to release a progestin. So this is going to thicken the cervical mucus, thin the uterine lining, and sometimes suppress ovulation. Then we have copper IUDs, so Paragard. So this is hormone-free, but copper can trigger an inflammatory reaction in the uterus, and it can also be toxic to sperm and eggs. So all are effective, there's no question about that, but none are without systemic effects. So what are the risks of the pill? So number one is hormonal imbalances and estrogen dominance. Synthetic estrogen is not bioidentical to natural estradiol. In women with estrogen dominance, so things like heavy bleeding, PMS, fibroids, breast tenderness, migraines, which are all the common reasons why you might go on this, adding synthetic estrogen can actually worsen these imbalances, especially when you're going off of the pill. In endometriosis, for example, the pill may reduce symptoms short term because it's going to suppress ovulation, but it does not address root drivers like inflammation, immune dysfunction, and of course, gut health. So number two are cardiovascular and cancer risks. So there's an increased risk of blood clots, stroke, and hypertension, especially in women that are smokers or women with clotting disorders. Long term, there could be a slight increase in breast and cervical cancers. However, there is a reduced risk in ovarian and endometrial cancers. Then we have mental health. So in a large Danish cohort, so this was a study in 2016 and produced in JAMA, there were higher rates of depression, especially in adolescents starting the pill. This is something that I'm always considering with the patients that I work with, regardless of age. But if they are suffering from anxiety or depression, I'm always looking to see if the pill is one of the drivers or correlated with the mood changes. Number four is nutrient depletion. So the pill can deplete B vitamins like B2, B6, B12, and folate, vitamin C, vitamin E, zinc, magnesium, and selenium. So these nutrients are vital for detoxification, and many are vital for neurotransmitter production like serotonin, dopamine, GABA, and energy production, i.e. our metabolism. So now let's get into the risks of IUDs or hormonal IUDs. So these are marked as local, but progestin actually still enters the bloodstream. So some of the reported side effects could be mood changes again, depression, anxiety, acne, bloating. It can also disrupt the natural estrogen-progesterone balance, leading to things like spotting, PMS, or even migraines. So it may suppress ovulation, as I mentioned, in some women, which can affect bone density and even fertility rhythms. Now we have copper IUDs. So the common side effects with these could be heavier and more painful periods due to increased prostaglandins. We can also have copper overload. So in susceptible women, we have an inverse relationship with zinc. So low zinc, magnesium, high copper to zinc ratio can drive fatigue, anxiety, and estrogen dominance. Some very rare concerns, but still nonetheless, systemic copper may affect things like gut balance, mitochondrial function, immune health, although the research in this area is still emerging. So then we have birth control and gut health. So the estrobolome, gut bacteria, is going to regulate estrogen metabolism. Dysbiosis in the gut, imbalance of bacteria, can lead to estrogen recirculation, worsening estrogen dominance. The pill can actually disrupt the microbiome and increase risk of things like like IBS, leaky gut, and even potentially Crohn's disease in susceptible women. So leaky gut, we have more intestinal permeability, we have more inflammatory molecules like LPS, lipopolysaccharide, leaking into the bloodstream, more systemic inflammation, autoimmunity, and potentially worsening endometriosis in that situation. Copper IUDs may also contribute indirectly to altering mineral balance, like that copper-zinc ratio, which can influence gut and immune function as well. So what are some of the key takeaways? So birth control is effective, and sometimes it is absolutely necessary, but it is not free of systemic impact. So the pill can worsen estrogen dominance and endometriosis if root causes are not addressed. This is not a solution for this. Hormonal IUDs can still cause mood and hormonal side effects. Copper IUDs may increase bleeding and alter mineral ratios and balance. And birth control can significantly affect the gut hormone connection, contributing to leaky gut and things like inflammation. We always want to consider nutrient status, detox pathways, gut health, and mental health when choosing or using birth control. These are things that really need to be evaluated in yourself, or if you're prescribing, to make sure that this is really appropriate for this person at this time. There is no one size fits all. So if you're on it or you're considering it, please ask, will this stop pregnancy? But also ask, how will this affect my hormones, my gut, my long-term health? So if this was helpful, please make sure you give it a like and a subscribe, and I will see you in the next video.